Hi, everyone. So glad you have joined us.
Welcome. Good evening.
Hello, hello. We'll give everyone about 2 more minutes just to get in, get their computer and their Wi-Fi set up, and then we'll go ahead and get everything started. While we're waiting, I would love for everyone, if you can, if you're by your device, putting in the chat an emoji to describe how you feel about this session today and where you're watching from. There we go. So, where are you from? And emoji on how you feel about the session. All right, we have Arizona in the house. We have Dallas, Texas. Shout out Anna. That's my market, Arlington Metro. Yes, live from Michigan. Welcome, Amanda. Yes, Brooklyn. Martha, I remember you. So glad to see you again. Yes, Latasha in Arlington. Austin, of course, Anna. I'm so glad you're here. And I love these emojis. Okay, we're excited. We're ready to be educated. I think this one's like a little curiosity. So I like it. I like the diversity here. All right, we're gonna give it about 30 more seconds and we're gonna jump in, get started. All righty, well, here we go. Well, good evening, everyone. My name is Dr. April B. I am the Inspire and Build coordinator at DivaDance HQ. I'm so excited to share with you our webinar that is in this talk show feel. So I hope you feel relaxed. I hope you feel ignited and excited and ready to learn, but also ready to feel empowered when you leave here. We have some really great information from a really great person that I'm going to introduce to you in just a second. First, I want to tell you a little bit of information about Inspire and Build. So, Inspire and Build derives from our Diva Dance values, which is inspiring confidence and building community. And so, Inspire and Build focuses on ways that our community can thrive beyond the dance floor. And so, this is what we do in our webinars, in our upcoming events and different initiatives. We want to see you expand and grow into inspiring that confidence and building community with each other through education and growth. And so if you want to stay in connection with some of the things that we're doing, the best place to find us is at our Inspire and Build broadcast channel, which is on Instagram. So if you go to the Diva Dance HQ page, you'll see a little comment bubble, and beside it'll say Inspire and Build. That's our broadcast page. Click on it, join, and you'll see all the next things that are coming up. Also, look out for our emails. We have things in the newsletter. So, again, if you're trying to keep up with what's coming up next, this is how you can learn more. Thank you so much to Elizabeth. She has dropped it in the chat for us so that you can click on it at our website as well. Awesome. Well, I don't want to hold you back any longer from this amazing topic. I think this is so important for us to talk about right now. And we literally couldn't have asked a better person to do this. And so we have Dr. Jess here to talk to us about understanding our women's health and how to be empowered and educated when you walk into that doctor's office and when you walk out of it. And so let me just give you a little information about Dr. Jess. Dr. Jess is in the Florida market. She specializes in oncology. She's originally from Northern Michigan, actually. She's a small town girl, but she's living the big town life in the Sunshine State.
I am.
She has been a dancer since forever, and she loves DivaDance that has embarked that childhood dream of dancing and being free. And you'll see it in her personality. She's so big and she's so wonderful and so light. Also, she's obsessed with Disney and dolphins, which is what's cool. We both have that in common. I love dolphins too. And she's a big fan of the USA Gymnastics. So fun, so broad. Everybody, let us introduce Dr. Jess.
Thanks, everybody. So glad to be here. When I first kind of approached Jamie with this, I mean, she lit up. I knew that I had no idea at the time that she was working on this Inspire and Build, this huge project and broadening the horizons of not just dance and fitness, but also mental health and also physical health and running her own health as a business and all these things. So everything kind of came in a line. It was meant to be. So this is my second project. I did a podcast, and now I'm going to try to do a series of webinars on several different topics, women's care related and some general health topics. And I am just so excited to be here. This is my passion. GYN, OBGYN was my original training, and then I went on and did a subspecialty in gynecologic oncology. So I take care of women with suspected or confirmed GYN cancers, cervical cancer, uterine cancer, ovarian cancer. And so this is my day-to-day life. This is what I do. This is what I love, is to help women provide knowledge, empower them, and give them the confidence to advocate for themselves and also take better care of themselves, preventative health, and just living their best lives.
Yes, I love that. I'm already excited. I'm already bought in of what you're going to share with us today. And so I want to kick it off because this is Hot Girl Health, and we're thinking about how to be our hottest girls in a greatest health. As you said, hopefully a series soon. And so I just want to kick it off with a discussion question. I have it posted in the chat. And I want you to use a thumbs up or a thumbs down. Again, maybe if you want to get creative with the emojis. But in true hot girl fashion, let's ask ourselves, I feel confident about my body and my health. So if you're like, yes, I feel confident, you can either put a thumbs up in the chat or you can push your reaction thumbs up. Maybe you want to push the rocket signs. Or if you're like, I'm not there yet, this is a safe space. That's why we're all learning together. And you just feel free to express where you're at today. Okay, we have some answers. That's okay. I embrace where everyone is. Thank you all for being so honest.
Absolutely. This is a safe space. And in this format, I do have some slides, not to be stiff or very structured or anything like that. It's just to kind of help me organize my thoughts and make sure that I get through the topics that I want to get through today. But please chime in to the chat anytime if you have a question, if you need further clarification. Today's goal is to kind of give a brief overview on the well woman exam and how to navigate it and kill it with confidence and feel like you left that appointment and got everything that you wanted out of that appointment, that all your questions were answered, you were educated, you got the test that you needed to get done, and you were empowered to live your best life and your hot girl self.
Absolutely. And so, speaking on that topic, I want to keep going further, which again, thank you all for sharing your perspectives because this is why we're here, because we're all in different spaces and how we feel about it. And so, I just kind of want to open up the floor with you, Jessica, and ask you, but also ask others, what do you think is the most uncomfortable thing about a well woman exam? So if anyone wants to jump in, put it in the chat. If anyone wants to raise their hand, say it out loud. Or if Dr. Jess, you have any suggestions of what people usually say is uncomfortable.
Sure. I think that for me, it's twofold. On one hand, there's a lot of very sensitive topics that women, even with a woman physician, do not feel comfortable bringing up. Mostly, I think because they believe that they are suffering in solitude, that this is only happening to them, that they're alone out on a limb. Sex is painful. Why do I leak urine when I do jumping jacks? you know, periods, are my periods truly normal? I don't even know what a normal period is. It's just, ooh, I talk to my friends about it, and I don't really know if this is normal for me. Is my weight healthy? Are my labs normal? But it's not having the confidence to speak out and ask questions. They're shy, they're held back, they're withdrawn, and then they don't leave the appointment thinking, getting everything that they wanted to out of it. And then the second is the exam, of course.
Yes, I agree. I think our women's health is, so normal, but, I think society sometimes has not made it normal to ask all those questions that all of us have. And so it does feel awkward to come in and say, this thing is not working the way I think it should be working, and hoping that you don't get judged, hoping that you get the answers and support that you need to get to where you want to go. Anyone else in the audience, do you have anything that makes the well woman exam just feel a little uncomfortable for you?
I can um join in here. I think I'm so glad you touched upon the solitude or the suffering and solitude, because I feel like, especially as women, a lot of times we do, we share and we communicate, and then when in your group, you're like, oh, that's different for me, or maybe so then it's almost even just the anxiety of like it's almost the anxiety is the what causes me the anxiety of getting there. And then as soon as I do share, I would say 100% of the time, the doctor's like, oh, yeah, that happens. And that you're not the only one. So I think that suffering and solitude is the part that, yeah, stresses me or gives me anxiety before I go in. But then I'm usually very quickly calmed when you know you're not alone.
Good. That means you have a good provider. She creates that safe space for you.
I agree. I think a good provider honestly makes it so much easier, which sounds like Dr. Jess is exactly what you are. So go ahead and give it to us. Walk us through of what a well woman exam looks like and how it should feel, all the things that we should be asking. Just walk us through. What does this well woman exam look like?
Perfect. Will do. I'm going to share my screen so you can see some of the slides that I have just to help us navigate. I will say, just going off of what we were just speaking on, that having a good relationship with your provider is the key to success. If you don't have trust, if you don't feel like you have confidence, if you don't feel like you have that this provider is giving you the time or rushes you or puts you straight in the straps and goes straight for the business rather than having the opportunity for conversation, then maybe that's not the right provider for you. And I would never discourage anyone from moving around to other providers until you find one that you really jive with, that is going to create that safe space for you. That's really what it's all about. All right. So our 5 objectives today, you've seen them on social media. We're going to go through what to expect during a well woman exam as in terms of the social aspect of the exam, and then the physical aspect of the exam, and then how you wrap it all up and leave feeling great. When should you start going to a gynecologist or a provider that provides GYN type care? The answer to this is you can start at any time. I have taken care of girls all the way down to the age of 13 that have kind of matured, right? You start your period, and you no longer feel like maybe you fit into the pediatric population, and you want to start having more conversations about periods and about contraception and about sexual health and all these things. And so I encourage, even I'll see the moms and they'll be like, when should my daughter start coming to see a gynecologist? And I said, we will welcome that at any age. But strictly speaking, you should start seeing a gynecologist on the regular at age 21. And the reason for that is because of the initiation of some of the mandatory screening. All right, so when you first start that visit, it ideally can start with your clothes on, and that way you feel comfortable, you feel confident, and you can start just by talking to your provider. And they're gonna start at the top and ask you, what is new since the last time we saw you? Is there any new history? Maybe you saw your primary and you have a new diagnosis of high blood pressure or diabetes, or you're taking a new medication, or since the last time we saw you, you went and had your appendix removed, something like that. They want a comprehensive history for documentation purposes to keep your chart up to date. The next part they'll go into is kind of narrowed down just into the GYN realm, and that is going to be, how are your menstrual cycles? Are you regular? Are you not regular? We can go into all of what that means, but typically a period is somewhere between 21 and 35 days. It happens on a very consistent, regular cycle and predictable. And you can use apps these days for this to track it so that you know if you are on a regular, maybe you're a 3-week person, maybe you're a 5-week person. What is your flow like? How many days do you flow? How heavy is your flow? Do you have severe cramps with your flow? Are you saturating and leaking through pads and tampons because of your flow? Do you miss work or school because of your flow? These are all really important things to mention when you're getting a very good menstrual cycle history, because it could be keying you into potentially some problems that could be fixed, and you could ultimately improve your quality of life by not having to bleed out every month. And then we go through medications, any new medications, allergies, supplements, over-the-counter things that you may be taking. And this goes all the way up into menopausal age women, which you start to accumulate new medical diagnoses as we age, and supplements, hormones, any of these things we should talk about. Next part, still closed, discussion about sexual health. Where are we at in terms of childbearing? Are we trying to prevent? Are we trying to conceive? Are we sexually active? Are we being safe when we're being sexually active? How are you putting yourself at risk of exposures, sexually transmitted infections, any concerns that you have? Are you having any abnormal discharge? Or are you in pain? Or you have a weird rash or a lesion down there? Anything that you would like me to take a look at? Next part is more of a health education piece and preventative health. And this really opens up, I think, the best way, it creates a space for dialogue in terms of how are we navigating mental health? Where are we at? Maybe you're freshly postpartum and you're having struggles with that. Maybe you are navigating through your menopausal transition and you're having problems with that. Maybe you have put on weight in the recent months and you want to talk about that. This is a great opportunity to try to bring those things up, because that's how the provider knows that they're important to you. And those are things that you really, key points that you want to have addressed and what you want to get out of this encounter. And then the other preventative health piece is any vaccinations. And we'll talk about specifically the HPV vaccine, because I think there was a question about that. So we'll talk about that later. Now you can take your pants off. And we move into the physical exam piece of the encounter. And that usually includes vitals, blood pressure, heart rate, listening to your heart and lungs, doing a breast exam, and then doing the pelvic exam. And then once that is all done, determine exactly what testing is needed based on your age, where you're at in your life, and any concerns that you may have had or brought up during the visit. Okay, so this is the last piece that I'll talk about with the exam in general, and then we'll kind of pause for questions and comments. What is a pap smear exactly? Show of hands, does anybody know truly what a pap smear is? In the chat, don't be shy. You'd be surprised how many people don't know what a pap smear is. Because I'll ask, when's the last time you had a pap smear? Oh, I just had one 6 months ago. I go back in the computer and there's no pap smear results. Oh, well, I had a pelvic. So that's the difference. A pelvic exam is not a pap smear, and a pap smear is not a pelvic. They are different. And this is the difference. Here's a happy little picture. It might be a little graphic for you all, and maybe triggering for you all, but this is exactly what happens in your girl parts when we do a full physical exam. The ever-loving speculum goes inside the vaginal canal, and it goes all the way into the very end of the tunnel until you reach the cervix. The cervix is the bottom portion of your uterus. The uterus and cervix are the same organ. For whatever reason, someone decided that they're going to call the top part of it the actual uterus or the uterine body, and the bottom portion of it that actually hangs down into the vagina is called the cervix. So the cervix, when you look at it, if you can see the insert picture up in the right upper quadrant of the screen, your cervix itself looks like a donut when you're looking at it straight on. And there's a small hole in the middle, and that's the hole that goes up into the cavity. It's where a sperm would go and meets up with the egg to get pregnant and have a baby, and then your baby grows up inside the uterine cavity. But on the surface of the cervix, there are cells. And when those cells are exposed to human papillomavirus, HPV, those cells can be transformed and changed into precancerous cells. And so the job of a pap smear is to use that little bristly brush to do a 360 turn on that cervix to collect a sample of the cells off the surface of your cervix, put them in a little dish, swirl it around, and those cells get processed to look for what's called dysplasia. Dysplasia is precancer, okay? And so if your OB-GYN calls you back and says your pap smear was abnormal, doesn't mean that you have cancer. It just means that perhaps at some point in your life, you were exposed to HPV, which is transmitted sexually. And there's a lot of stigma about sexually transmitted infections, but HPV itself, about 80% of the population has been exposed to HPV at some point in their life. So it's common, okay? It just depends on which strain of HPV you get. There's a lot of different strains of HPV, and there's a collection of about 14 or 15 that we know of right now that are considered the high-risk strains of HPV that are more likely for your cells to turn into dysplasia and your immune system to not be able to get rid of this infection. So does that make it a little bit more clear what exactly we are accomplishing with a pap smear? Okay. Oops. So a pap smear does detect precancerous changes of the cervix, and it also now has the ability to check and diagnose you positive or negative for the high-risk HPV types. A pap smear does not check for STDs, sexually transmitted infections. It does not screen for any other cancers other than cervical cancer. So in my field, I'll have women come to me and be like, well, how wasn't my ovarian cancer caught? I've been getting pap smears every year since I was 30. It's not meant for that. It's only meant to screen for cervical cancer. All the others are screened by other ways. Some of them don't even have screening. Ovarian cancer doesn't have screening, which is a whole nother talk that we'll talk about, and why it is kind of silent, but can be potentially deadly. It does not check for other structural problems with your uterus. It does not check for endometriosis, another condition that we'll talk about at some point. And it doesn't check for hormonal disorders. So it's very limited in what it does. The second portion of a pelvic exam is we take all that contraption out of your vagina, and then we usually just do a feel. That's done by inserting one or two of our fingers inside the vagina and the other hand on the top of your abdomen, where we can feel the size and shape of your uterus and potentially your ovaries on either side. So that's another method of screening to see if there's anything structurally abnormal about your GYN organs. All right, I'm going to stop there for a moment because that was a lot, and turn it back to you for a second.
Yes, that was a lot, but that was a lot. I mean, I feel like I've learned everything. Like, I've learned things that I didn't even know were. So I love how you started out with asking, does everyone know what a pap smear is? Because I think we hear those use a pap and a pelvic used interchangeably. And so that was really helpful. But on top of that, it was also helpful to learn all the different things that we should be asked about as well as bring up. And so again, I just want to see either you can drop in the chat or you can just put a thumbs up, thumbs down on your screen. How how close to what Dr. Jess just shared, how does your well woman visits look? You feel like, yeah, like I get asked all those questions, I ask all those questions, I get these things, or do you feel like, oh my gosh, this is like nothing that I thought was going to happen? Give me up, thumbs down, or your favorite emojis that you like to show me.
My OB-GYN is a godsend.
Oh,
She's
we love that. We love a
amazing.
good
Pretty
OB-GYN. Oh,
similar.
straight up to painless. No. Oh man.
Oh, it sounds like perhaps you should start looking for someone else.
Oh man. Yes. And so for those, okay, we love seeing the
I'm
checks. We
glad.
love
Yeah, I'm
seeing
glad that there's
thumbs
a lot
up.
of positive experiences.
Oh, good. I love that you're preparing for your first appointment. That's like so exciting. You know what to say. Good. Okay, so it looks like a lot of us have some good guides, but
Good.
some people are like, you know, what's happening. And so, besides, of course, if you were to run into a situation that you may not know exactly what they should ask of you, what are some ways that you can maximize your visit? Like, what are ways that you can contribute and really get involved in your visit to ensure that you're getting the best resources and the best tests out of your visit? Dr. Jess, you there?
Oh, yeah.
Oh, yeah.
I
Sorry, that
wasn't
question
sure
was
if
to
that was
you.
a poll or
Oh, yes. No, that was,
if that was
sorry, that was a
pointed towards
question
me.
to
I am so
you.
sorry.
Yes. No, no, no. It's
Um,
okay. So, for those who are struggling with figuring out, like they
yeah,
go
I
there and
think
they're like, I don't even know what to ask, what are some good ways you can maximize your visit?
sure. I see it often. I feel like when when you walk into the room, you get nervous and your mind goes blank, right? We've all been there before, even not in provider visits, just in general. And so to prepare and not just go in blind, but to truly prepare yourself as if you're going in for a job interview, really, of all the pointed things that you want to get out of the visit and write them down. I have patients come in all the time and they're like, wait, before you go, I have this note page that I'd like to really go through these questions and make sure that I have the answers to all these things because I wouldn't have remembered otherwise. Great. Love it. Do it. So if it's about your periods, if it's about painful sex, if it's about leaking urine, ask them. I promise they're not weird. I promise you are not the only one. And we've heard it before, and we are prepared to answer those questions. And if it's something that we've never seen before, we will circle back to you and we will find out resources that can help you. That is what we are here for.
I can also,
Good.
can I jump in? I
Oh,
can
all the
also,
way.
yeah, I can also c confirm. So exactly what you said, Dr. Jess, is like, it's like as soon as I walk through the door, like I just feel like I go, just like paralyzed. I forget
You're like
every,
numb
yeah,
and you're already thinking about the stirrups and you're like,
yeah.
did I hide my underwear right?
I said all
That's
the
me.
things. That's all the things. And what's funny is there's been a couple of times where I've gone and then after my husband's like, "Well, did you ask about this?" And I'm like, I blacked out when I was in there. Like I just got through the
Yeah.
appointment." So I started taking notes as well because um I just knew like at some point I would be like, "Oh wait, I have these." And these are the questions. And I would also say
Yeah.
to someone like I kind of stress about like health anxiety things. It at least helps um like it always makes me then feel like calmer once I get all my questions answered. So I always like encourage my friends. I'm like, make sure you write the list because that'll
Yes.
at least know
The
you
list.
you ticked all the boxes.
The list. Yes.
Yes, that's so great that you have a list. I resonate. Like you go in there and it's like just all of a sudden, and then like they wonder why your blood pressure is so high. And it's like because I'm thinking about all the things that I forgot to think about. And then, like you said, the stirrups are so cold. I forgot to wear socks. Do I have the right underwear on today? Like, are they gonna make fun of my underwear? Like, it's just the wrong things
Like
that we think
I
of.
forgot to shave.
Yeah, I forgot to say they're gonna be like, I
We
can't
don't
get this here,
we
you
don't
know?
care about any of that.
Yeah.
We don't.
Yes. And I think that's why it's so
I
wonderful,
need a
one, to
pedicure.
have a doctor that you trust, but you're right. But also to like what I hear is like a sense of wellness and like almost, my background's in wellness. So I have to bring in the mindfulness almost of like, okay, this is
You
so
have to be
important to me.
intentional. You have to be mindful.
Yeah, and like my health is important to me. Let me do the things to make sure that I like meet all the needs that I need to meet. I need to make a list. I need to like, set my appointment in a time that I'm not like rushing in between things or I have to go to work or I'm coming from work and I'm stressed.
Yeah.
And figuring out like, okay, how can I really maximize this visit?
Yeah.
So continuing to think on the terms of maximizing and optimizing, we do want to think about our reproductive health and not just like kind of its own little box. We want to see how it connects to the rest of our health and the rest of our wellness. So can you kind of unpack that with me of like how does this visit connect to the rest of who we are as women?
Sure, of course. When you optimize your health and you feel like you are actively addressing any issues that you have, and it all depends on where you are at in your facet of life. Like if if trying to get pregnant is your number one priority right now, then you want to go into that visit and ask all the questions about how you can best prepare and optimize your health for a future pregnancy. What are the supplements that I should be taking? How should I be monitoring my cycles? Is there something that I can look for? Am I doing something wrong? You really want to tailor your visit because at the end of the day, if you leave the visit and you don't feel like you got your questions answered, how is that going to transpire in the rest of your life? You're going to be stressed, you're going to be upset, you're still not going to have the answers that you want. You may not achieve the pregnancy because you didn't have the right information, and relationships suffer, you're stressed, you're distracted, work can suffer. And that, I mean, like that's just pregnancy, that's just one example, but that goes for so many other things. Like women that have fibroids and every month they will bleed to the point of anemia. I mean, I'm taking care of women that bleed so much they need blood transfusions because of fibroids or some other condition of their uterus. So how does that make them feel? I mean, they're fatigued, they're run down, they can't perform at their top performance. They're tired, they're missing work, so they're not productive. Finances can struggle because of that. Childcare, you're just not your best self. And so if you had a GYN visit and they didn't even give you the time to bring up the fact that you need a transfusion every month, then you're not taking control of the situation. You're not advocating for yourself, and you need to be more active in your own health.
Yeah, those are powerful words that you said. I love how you put the opportunity of power on us. You know, like I think of course, we can focus on the doctor of like making sure we have a doctor that makes space for us and that are professional. But I think also like feeling like we can feel empowered enough. We deserve to feel empowered enough to walk in there and take control of our health and say the things that need to be said, not just literally physically, but also the extension of that. Like you said, of, I transparently, I have PMDD and when
Mhm.
I'm in those seasons where my PMDD is the highest, I don't feel my best. I don't feel pretty. I don't feel attractive. I don't feel like just as bubbly or as open and extroverted. And that's really hard on me.
Mhm.
And I think, if I just bring it up kind of flippantly about my PMDD, it's like, oh, well, like, let's change diet here and let's do this. But if I say, and it makes me feel like this, now it's like,
Mhm.
oh, well, let's bring in some other people. Let's bring in a therapist. Let's bring in holistic medicine. So now I'm addressing the thing that probably like will reduce my symptoms a lot more because I'm more expansive about that whole entire wellness than just the
For
symptoms. So
sure.
I think again, I love how you're empowering women to be like, hey, say all of what you're experiencing and stand firm in that so that way you can get all the help that you deserve to receive.
I forgot what I was going to say because I was reading the comments in the chat, but we're the women of 2025. This isn't the same healthcare that was even 20 years ago or before that. Medicine used to be a very paternalistic approach. There used to be a huge lack in research on women's subjects in general, and that has changed so much, and they're really focusing more on women's related diseases, women's related cancers, menopause. I mean, we have now FDA approved medications that are non-hormonal for the treatment of hot flashes. Finally. I mean, how long did that take? Men had the little blue pill for who knows how long, right? So things are evolving, and it is creating the space for you to be able to advocate for yourself.
Yeah, that's so good. I'm gonna throw just a little caveat in here, because Martha brought up a great subject, and I was just seeing if you had any expansion on what this well woman exam would look like for someone who is in menopause or post-menopause, because we talked a lot about, the birthing questions or period questions, but for someone
Sure.
who has progressed beyond that stage, what would those exams look like?
Yeah, absolutely. The physical exam is still very important, and pap smears are usually continued all the way up until about the age of 65. As long as you have a series of normal ones, you usually can stop. And I always say that with a caveat because 65 is kind of an arbitrary number, right? And as women, we live longer than men, and so and we may outlast our partners, and we may have new sexual partners. So HPV exposure can always be there. So I would just take 65 kind of with a grain of salt, because your providers will tell you, oh, you're 65, you don't need to have them anymore. And be like, actually, I really would feel more comfortable if we continue to do this, or I have a new partner and I feel like we should continue this on, or I've had previous abnormals, and it would just help my mental health if we just continued this. And also, I kind of want to make this clear that in an older woman population, they're often dismissed by their primary care physicians, or some of the primary care providers that may not be so comfortable with doing female sensitive exams, breast exams, and pelvic exams. And so when women reach that age, they'll be like, oh, you don't need a pap smear anymore. Therefore, we don't even need to examine you anymore, which is so far from the truth. Or you've had a hysterectomy, we got nothing to even see. That's not true either. I mean, every day I see women that have vulvar skin disorders, vulvar cancers, vaginal cancers, and or even skin conditions or just painful sex or dry vaginas because they're menopausal and they have a sexual disorder because they don't want to have sex, or they have low desire because they know when they're going to have sex that it's going to hurt. And so it creates, by continuing to see a gynecologist or some sort of provider that would do a pelvic exam on you, it just opens the opportunity to have these conversations, to make the uncomfortable and the awkward comfortable, to create the safe space, create the setting to have all these discussions. It is astounding how many women have incontinence, or not even incontinence, but just like frequency and urgency. 40%. Do you know how many people report it? Maybe 10%. Because it's got a little bit of stigma to it makes you feel like you're old. There's people will avoid bringing this up because they are embarrassed. If you are in your friend circle, women, and one is brave enough to say, oh yeah, I leak every time I do jumping jacks, hands will start going up all around that circle. It's common, but there are things that we can do as providers that can help you to treat that, to cure that, to do a procedure, or just do some behavioral modifications, lifestyle modifications to take that away, pelvic floor therapy. So you don't know unless you ask.
Oh, this is powerful. This is really good information. And I'm so excited to jump into these questions. I know we have like a short period of time left, but before we get into those questions, I just want you to lightly touch on what does a follow-up plan look like? Okay, we've got the questions asked, we've taken the pants off, we put them back on. What do we need to do to leave to make sure that we're still optimizing our health?
For sure, for sure. So we call it kind of a wrap up, and I try to give my patient a synopsis. Okay, this is what we talked about. These are the key points. This is where you're at in your life. So based on your age of 55, we need to make sure that we did a pap smear today. We need to make sure we order your mammogram. And I want you to focus on, we talked about weight loss options. I want you to focus on doing a food diary. I want you to focus on keeping a journal of your physical activity, start monitoring your steps, incorporating some weight training. And then we also talked about sexual health today, and I want you to try this new prescription or natural lubricant or something like that. And then I would like to follow back up with you, and I do this often, and is follow up via like a virtual telemedicine visit. I do this with my patients often, just so that we can circle back and we can be like, how's that lubricant doing? Here's the results of your mammogram. Here's the results of your pap smear. Do you have any questions about the results? Is there any other follow-up that's needed because something was abnormal? Or is there anything else that we missed at the visit that you thought of when I walked out the door? COVID, if one good thing came out of COVID, it was the healthcare industry's ability to do medicine virtually. Because once you have done the physical exam, things can be done just like this. Talk about results.
Yes, and I love that too. I love the accessibility of being able to practice medicine anywhere because now it just feels like we really have so much more control over it.
Mm-hmm.
Okay, well, we have some more questions to ask you. If anyone else has any questions along the way, feel free to interrupt us with it. Either drop a question in the chat, or you can just put a little hand up for on your screen, and we'll be sure to get to you. But I have five different categories of questions, so here we go. The first category is about sex. So I'm kind of like combining questions together. So one is, sex is painful. If sex is painful for someone, what can I do? And also talking about libido. Like if you feel your sex drive going down, is that normal? Is something wrong with me? And what should I do?
Sure. Sex could be its own hour talk in and of
Yeah.
itself, but I'll kind of give the Cliff Note version of sex. Women are not like men, first and foremost. So you need to know that and understand that, to know that women day to day are not going to probably meet on the same level as men in terms of sexual drive and libido. But that's not always the case, but just in general, that is a normal thing. Um, Sexual desire, low libido is so multifactorial for women. It's not just about the ability to have an erection, right? That's majority of it for men is can they have an erection or not. For women, it's physical causes, like it's really painful to have sex and therefore I don't want it. Simple as that. Or it's too dry, which are fixable things. So those are things you should bring up. There's other diseases or medical conditions that you have that will lower your sex drive automatically. Diabetes being a huge one, and blood pressure, high blood pressure, hypertension being another, as well as any type of heart disease. Because if you can't walk up a flight of stairs, you're probably not going to be in the physical condition to have sex. There are medications that lower sex drive. Antidepressants like SSRIs, class of medicines, are a big one. Alcohol might put you in the mood, but too much alcohol can affect your sex drive, and chronic alcohol use can also affect your sex drive. Smoking decreases blood flow down there because it causes vascular damage. So that also inhibits engorgement and pleasure associated with sex. Any type of body altering surgery, or maybe a major surgery from a trauma or something like that, big scars, which kind of leads more to body dysmorphic disorder. You don't physically feel sexy, and so that turns into more of a psychological manifestation of having low sex drive, stress, and you just don't have the time to fit in a 5-10 minute session here and there between trying to get the dinner ready or getting the kids or whatever. Stress in and of itself, and that happens at different phases in life too, can put a lot of strain on a relationship, and that can in and of itself be a cause. So as you can see, it's a huge ocean of complex issues. So it's not just a why don't I have high sex drive anymore. Postpartum, very low sex drive, and that's hormonal. All your hormones of pregnancy that were surging plummet down to almost menopausal levels when you're postpartum, and so that is very hard. That's where postpartum depression comes into play too. So very, very normal physiologic response and usually temporary. There is a new medicine now out, relatively new, that is FDA approved for increasing sex drive in women. It's called ADDY, ADDYI.
Here, I'll put it in the chat if anybody needs it. ADDYI. There we go.
Mm-hmm. So look into it. You can always ask your own provider about it and see if that medication is potentially right or an option for you. But I also would do a really deep self dive into trying to figure out the root cause for why you have a sexual dysfunction at this point in your life. Is it temporary? Is it situational? Is your relationship healthy with your partner? Are you physically healthy and optimized? And then kind of go from there, because the pill is not like a one size fits all type of deal.
Absolutely. And I love how you started off with its own talk, because that gives like a nice deep breath of relaxation that there are a host of things. It's not this like one thing or there's something wrong with you. There's just so many factors that can contribute to it. And so we are all so different and unique. And so finding the things that make us the healthiest is just how we can best
Yeah.
solve those problems. So that really is so helpful. Okay, so our next topic is hygiene. So what are some things that I can do at home to keep the greatest hygiene for my reproductive area? So, also funny story to me. I watched this awful show called Pop the Balloon, and it's basically about like these people line up and they have a balloon in their hand and like a person comes out and they pop who they don't want to date and then they like keep who they
Okay.
do want. And so a lot of the men like off rip say like I don't want a woman with bad hygiene. So apparently like it's a really common thing that comes up. I hear a lot of women we like lightly talk about it with each other, but as you said like no one wants to have that full conversation of like how do I wash myself when I'm on my period? Like how do I smell good? So what's your suggestion? To shave or not to shave? Yes, all those different things.
I don't know that I can say to shave or not to shave. I don't think that one is more clean than another. It's more just about the hygiene. So there's a difference between the vulva. The vulva is the skin on the outside, that's your labia and the hair-bearing area, and the vagina, which is on the inside. So for the most part, you want to just cleanse the area with warm water and then a very gentle, mild, unscented soap just on the outside, on the vulvar area. You don't want soap up in the inside in the vagina area because it's too irritating. And when I recommend to women like a mild unscented soap, I usually do like a Dove sensitive skin bar soap or a liquid soap. Aveeno is also got another good one that, and sometimes they'll advertise that it's sensitive or that it's female sensitive or a natural, balanced pH, that type of thing. So that's kind of it. It's really not rocket science. Warm water and a mild soap. Really avoid douching. Douching will disrupt the natural balance in the vagina. The vagina itself is a very unique environment. It is very acidic. The normal pH, if you're a sciencey person, normal pH of your vagina is 4. pH of water is 7. So 7's kind of run of the mill. 1 is the most acidic and 14 is the least acidic. So 4 is pretty low. And then like a pH of 1 to 2 would be like your stomach acid, if that gives kind of a relative comparison. So your vagina is very acidic. It is a self-cleaning organ. So if you just let it do its thing and keep the outside fresh, change underwear often, especially after exercising or if you're sweating outside, change your underwear. If you can sleep without underwear, like when you're not on your period, then that's also very helpful. Let her breathe and then just keep it clean, keep it dry. You don't really necessarily have to douche anything up inside because it's going to disrupt the pH balance.
Got it. So things like Summer's Eve, what do you feel about products like that?
I feel like for the most part, a lot of them are a little bit too harsh, and all the ones that are scented are probably not the best,
Hmm.
and can increase your risk for vaginitis, vaginal infections, just from getting an imbalance in that pH or UTIs as well.
Got it. Okay, this is super helpful. Okay, we got about two more topics maybe. Next one, we're going to talk about periods. I'm going to just try to sum it up. How will you know if your period is abnormal, whether it's like the amount of blood, whether it's how heavy you're bleeding, whether it's like the type of cramps, how do you know? And then if you figure that out, what are your next steps?
Sure. We went over a little bit the duration of a period, and it differs for every woman, but once you find your clock, you track it to make sure that it stays regular. There's women that will skip months at a time, and it just means typically that you're not ovulating or that you have a hormonal imbalance and you're not getting that consistent shed of the lining each month. But there's side effects too. Like if you're on birth control or some sort of hormonal or an IUD, you may not bleed, and that's the normal for you. But you have to talk to your provider about what should I expect based on my situation. But typically, a menstrual cycle is anywhere from 3 to 5 weeks, and I can show you a full picture of, and maybe this is a talk in and of itself about the roller coaster of what happens in your menstrual cycle, and I think it's probably a really good talk just to give you a sense and breath of these are the days when I should feel like this, and these are the days when I should feel like this, and eat like this too. It's changing your diet as you course through your menstrual weeks is actually really revealing and very healthy, uh, and your physical activity as well. But you find your pattern, and it should stay consistent. Bleeding should be anywhere from 2 to 7 days, and it should stay consistent. Flow, mild to moderate. You should not be saturating a pad or a tampon in an hour or less is considered too heavy of flow. If you're saturating and bleeding through either of those things or having accidents, that is probably worth mentioning to your provider. If you have had to miss work because you can't get out of bed because your pain is so painful that you're in the fetal position and you got to order Taco Bell, you should probably talk to your provider about it because there could be something else going on. And it could be something that's just a hormonal imbalance. It could be something structural like fibroids. It could be also something like endometriosis or adhesions or something that's causing this. And so just lay it out there for your provider and ask them if it's normal or what they think in as much detail as you possibly can.
Awesome. And we have a branch of that question. At what age range should cycles regulate? So do teens have kind of just erratic cycles when they first start their
It
periods?
can take up to a year for a teen to regulate.
Okay, that makes
Yeah,
sense.
because their hormones are just starting to get up to the point where they will have a consistent ovulation each month.
Okay, yeah, that
And then
makes
also towards the end too, once you get in menopause, perimenopausal type of area, like the in between, as you're transitioning to menopause, you could go almost 6 months and not have a period and then randomly have one. But perimenopausal and abnormal bleeding in that period of time, you should be having conversations with your gynecologist about what's normal and what's not normal.
good. I'm glad you brought up perimenopause because we have one more category, which is perimenopause, but also menopause and postmenopause. And there's a lot of people that asked about the impact of weight and weight loss in on those seasons, which I know those are
Mhm.
three very distinctly different seasons. But can you talk more about what weight management looks like and what weight loss looks like just in the transformation of your body from perimenopause to menopause to postmenopause?
Absolutely, that we get this question often. It is a real thing. When you have any major transitions in your hormonal status in your body, it causes a restructuring of your metabolism, and usually a slowing of your metabolism with a decrease in your hormones. A major misconception, and I think a thing that happens in the public is, oh, if I take hormones, it'll vamp back up my metabolism, which is not technically true. The best way to reboost up your metabolism that has kind of naturally faded with age is physical activity. The more you exercise and diet comes into play as well. But exercise is key in resetting your metabolism. And whether it's DivaDance classes, but also weight training. I can't stress enough how important weight training is for a woman later in life, at any phase in the life, but definitely later in life is so important. By building muscle and surround and all your major big muscle groups in your thighs and your legs and your glutes and your arms and your back, the more muscle you have in your body, the more you're burning calories at rest, which automatically resets your metabolism. And then as women, once we fade out of our hormones and we lose estrogen, we now have a new issue to worry about, which is osteoporosis, thinning of our bones. And so the more you pack muscle around your bones and joints, the less you're going to be at risk for a hip fracture or a compression fracture.
Oh, this is all great, 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 great information. Do you have any last minute questions from anyone in the audience? Anyone want to come off of mute? Yes, being a woman is iconic. We conquers so many amazing phases of our lives, and it's amazing. Mm. But does anyone have any other questions that they would like to ask Dr. Jess? Yes, Caitlin. You want to go ahead and come off of if you want to unmute, or does it do that? Let's see. You can go ahead and ask whenever you're ready.
Thoughts on reusable products? I I'm wondering if you mean like a Diva cup. I think that's maybe what you're referring to when we talk about reusable products.
Hmm.
They're very healthy, very hygiene friendly, as long as used properly. Change it out.
That. Clean it correctly,
Right.
yes. Caitlin, I see your hand up, but I'm not sure if you're able to come off mute. So let us know if you still have a question.
I'm
But
gonna leave, well, if as we're wrapping up, I'm gonna put up this slide about future topics and just to kind of get a taste of what could come in the future. And if you have a topic in mind and it's not something that you see on this list, then please message me, DM me, Diva Dr. Jess, my Instagram, send a message to April. And thank you guys so much for your
Um,
attention and your engagement.
Dr. April, did you see the um question that just came in? Caitlin tried, but
oh yeah, I was looking for why that won't let it. Let's see, Caitlin. Let me see if I can do it manually this way. Um, oh, boo. I don't know why it won't do it. I'm so sorry. Um, so let's see. The question is, the new state guidelines state that a pap smear is needed only every 3 years if you never had an abnormal. Can we still request it, even though those are the guidelines?
Yeah, you can definitely request it. I've not ever had any issues with like insurance companies denying it or any
Hmm.
sort of things. You know, sometimes they can catch up to the guidelines and start refusing it if they see, but I've never really had a problem with that. I don't think any of my colleagues have either. Uh, the beauty of that though is that that recommendation is built on data that was taken from tens of thousands of women and tracking over time. If you have this pap smear, what is the fallout and the timeline for things that could happen? So it takes on average approximately 10 years from HPV exposure and abnormal pap smear to manifest as cervical cancer. So if that gives you some peace of mind that 3 years is okay, it truly is okay. If you've never tested positive for HPV in the past, or if you've never had an abnormal pap smear, especially if you're in a monogamous relationship, 3 years is safe. But you can always ask your provider and say, hey, I have an abnormal discharge, or I had a new partner, or something's different. Any reason, I can't imagine that anybody would be like, no, we can't because it's only been 2 years.
Great. Well, I see a lot of people that are excited to see more about these topics. So again, if everyone could, I'm trying to go back to see everyone's face. There we go. So if everyone could go to our Inspire and Build broadcast channel, just drop in there first how amazing Dr. Jess was in here. Let's give it up for Dr. Jess. Maybe send all the clapping hands, all the woos, because Dr. Jess is amazing. She's not only so knowledgeable, but she's just so warm and sweet. And this has been more than an amazing and empowering session. And this is exactly what we need, speaking in the terms of hot girl health. It's confident. I feel lifted. I feel ready to call my doctor. It feels good. So if you feel the same. Again, please go to our Inspire and Build broadcast channel. It's at our DivaDance HQ. Instagram, you go down, there's a little comment thing, little chat things, and you click on Inspire and Build. You'll become a part of our broadcast channel. Tell everyone how awesome this webinar was, and then also drop in there, this is what we would love to see next. So that way we know what you would like to see from us, and possibly from Dr. Jess in the future.
And Miranda, I saw your comment in the menopause sector. We're going to go dive all into hormonal health.
There you go. All right. Well, if we do not have any last minute comments, Dr. Jess, I just want to thank you so much for joining us today. Thank you for giving us your time, your energy, and your expertise. And we are just excited to see you all next time. We have some more things coming up, so please continue to stay connected with our broadcast channel as well as the emails, or go on our website and you'll see more things that will fulfill us outside of the dance studio. So thank you all again for joining and have an amazing rest of the evening.
Thank you all. My pleasure and my honor.
Yes, you all take care.
Thank you.
Hmm.
Bye.
Bye bye.